I remain optimistic. The past 40, 50 years have shown that research, public health research, medical research can inform evidence based policies that can save lives. We've seen that for car crashes, we've seen for in terms of tobacco industry, we've seen that in many, many, many different contexts. It is highly political and sensitive in our country when it comes to gun violence research. Um, we have heard more voices explicitly talking about this in the past couple of years. So I remain optimistic despite all the challenges that collectively we can hopefully make a positive change on this.
I'm a little bit less optimistic than Dr. Rouhani. Um, the tragedy in Orlando was horrific, as President Palmer said, but I think what we have to realize is that there are over 30,000 people a year who die from gunshot wounds, and it means that there are equivalent of two Orlandos every day that are happening and have continued to happen. And in fact, in the last 45 years, there have been more people who have died in our nation's cities and streets than have died in all the wars in our history as a country. 1.4 million compared to 1.2 million deaths. Here in our city, we've been very fortunate in having support from the city council and the mayor to support gun research. But because we haven't been able to get money from the CDC for gun research, we've also turned to crowdsourcing. So we have set up a website at experiment.com for individuals to contribute money, $100, $200, $50, $10, to support gun research that we want to do here in Seattle to try to better understand how we can prevent these tragedies from happening. With the crowdsourcing, what specifically we're trying to do is to figure out how to improve safe storage of guns and prevent suicide. What people don't realize that in the United States as a whole, 63% of the gun deaths are suicides. They're not homicides. Here in the state of Washington, 80% are suicides, not homicides. So we really want to try to address this terrible, tragic use of guns to take a life. We realize that the means matter. If you try to kill yourself with a gun, you're going to be successful nearly always. If you try to kill yourself taking pills, you're going to be successful only 1 or 2% of the time. So means matter. We want to try to have people store guns more safely to prevent them from getting into the hands of someone who might use them to hurt themselves. And that's what we really want to try to do, is figure out how to do that with this crowdsourcing money.
We conducted another study a few years ago. It was a statewide study looking at all those individuals who had been shot and hospitalized anywhere in the state. Um, we looked at their records to see what happened to them after they were discharged from the hospital. It was a 5 year follow up, and we were interested in mainly looking at crime perpetration, injury victimization, and death. And numbers that came out of that investigation were really mind boggling. One statistics I always share with colleagues is that we found those individuals were 21 times more likely to get shot again and hospitalized. Um, so that really called for action, to do something about that vulnerable group. And what we are doing currently is exactly that. We are studying an intervention for the first time, to our knowledge, ever conducted, um, that tries to help these individuals get the services they need when they transition back to their communities.
One of the things that was said on the House floor this week was that there isn't going to be one single thing that is going to eliminate gun violence in the United States. It's a complex problem. We have probably 300 million guns in households in the United States. It's going to take a variety of interventions, and I think what everyone is asking is, we really need to start. We can't continue to delay trying to address this problem. We're not going to eliminate it right now, but we have to start with the idea that we can eliminate it eventually, and it's going to take a lot of work and a lot of different kinds of interventions to do that, and it's time to get started.